welcome to our channel Dissection of Human Body. We are going to have a series of videos on osteology of head and neck. Osteology of head and neck includes the skull and mandible plus the cervical vertebrae. The structure of the skull, external feature of the skull, can be studied by looking at it from various angles. The study of the lateral view of the skull is known as the Norma lateralis. When you are looking at the skull from above, it is called Norma verticalis, and the posterior view is Norma occipitalis. When you are looking at the skull from front, it is called Norma frontalis, and the basal view is Norma basalis. In this video, we are going to discuss about the external feature of the Norma lateralis. The structure of the Norma lateralis will be discussed by one of my colleagues, Dr. Aparna Muralidharan. Over to her.
Hello students, today we are going to see Norma lateralis of the skull. So skull can be seen in different views. Today we will see the lateral view of skull, which is called as Norma lateralis. To learn Norma lateralis, first we should identify the different bones that can be seen in the lateral view of the skull, as well as some specific features that can be identified in this view. So first let us learn the bones that are present in Norma lateralis. So from before forwards, the bones that are seen in Norma lateralis include the maxilla, the zygomatic bone, the frontal bone, the greater wing of sphenoid, parietal bone, squamous part of the temporal bone along with the zygomatic process, the petromastoid part, of which the petrous part is not seen in Norma lateralis, the mastoid part can be seen, tympanic part of the temporal bone, and a small part of the occipital bone. So now let us see what are the features in Norma lateralis. The most characteristic feature that can be seen in Norma lateralis is this subcutaneous bridge, which is called as the zygomatic arch. Zygomatic arch divides the entire Norma lateralis into a fossa above, which is called as the temporal fossa, and a fossa below, which is called as infratemporal fossa. As you can see here, zygomatic arch is formed by two bones. In the anterior 1/3, it is formed by temporal process of zygomatic bone, and in the posterior 2/3, it is formed by zygomatic process of the temporal bone. There is a space deep to this arch separating the arch from the lateral surface of the skull. So first let us see the features of the temporal fossa. So this concave depression that you can see above the zygomatic arch is called the temporal fossa. It is bounded anteriorly by the temporal surface of the zygomatic bone. It is bounded above and behind by temporal lines. It is bounded below and behind by a crest called as the supramastoid crest. And in front and below, it is deficient where there is a gap, which I have already told, which communicates temporal fossa above with the infratemporal fossa below. So now let us see each feature one by one. So first let us see what are temporal lines. So if you see this lateral wall of the orbit, we have the zygomatic process of the frontal bone and frontal process of the zygomatic bone meeting at a suture called the frontozygomatic suture. If you trace from the frontal bone above, that is from the zygomatic process of the frontal bone above, you can see a line that arches above and behind. There will be two such lines running parallel to each other. The upper line, called the superior temporal line, will be traced posteriorly and eventually it fades away. There is a line running parallel and below the superior temporal line, which is more prominent, and it runs posteriorly and it doesn't fade away. In turn, it continues downwards and continues with this crest, which I have already mentioned, that is the supramastoid crest. So what attaches to the superior temporal line? The fascia in this region, that is the temporal fascia, attaches to the superior temporal line. Then what attaches to the inferior temporal line? It is the muscle, a fan-shaped muscle present in the temporal fossa, which is called as the temporalis muscle, that attaches to the inferior temporal line. So the temporalis muscle takes its origin from the inferior temporal line, as well as the floor of the temporal fossa, as well as the overlying temporal fascia. Now what are the features that you can see in the floor of the temporal fossa? In the floor of the temporal fossa, we can see mainly 4 bones. They are squamous part of the frontal bone, the parietal bone, greater wing of the sphenoid, as well as the squamous part of the temporal bone. The most important and the most characteristic feature is what you can see here. It is a region where all the 4 bones meet at an H-shaped suture. So here we have frontal, temporal, antero-inferior angle of parietal bone and the greater wing of sphenoid meeting at this point. This point is called as terion, which in a neonate will be unossified and is called as anterolateral fontanel, which is also called as sphenoidal fontanel, which will ossify by around 3 months of age. What is the surface landmark of terion and what is its importance? So as you can see here, terion is located 4 centimeters above the zygomatic arch. We know that zygomatic arch is subcutaneously palpable. So this is present 4 centimeters above the zygomatic arch and is present 3.5 centimeters behind the frontozygomatic suture, which is also palpable in the lateral wall of the orbit. The importance of terion is that apart from that it is ossified anterolateral fontanel, deep to it lies the anterior trunk of the middle meningeal vessels, as well as deep to it lies the stem of the lateral sulcus of the cerebrum. So it's clinically very important to know the surface landmark of terion. Traced behind, as I've already said, the floor gives rise to temporalis muscle, whose fibers converge and the tendon passes through this gap beneath the zygomatic arch to come down into the infratemporal fossa and to attach onto the coronoid process of mandible. In some skulls, we can also see an impression of a blood vessel in the floor. This is the impression of middle temporal vessels, which is a branch of the superficial temporal artery. Now let us see the parts of zygomatic bone and zygomatic arch. So on the facial part of the zygomatic bone, we can see a foramen. This foramen is called as zygomaticofacial foramen that transmits the nerve of that corresponding name. Same way on the temporal aspect on the zygomatic bone, another foramen is seen. This is called as zygomaticotemporal foramen, which transmits zygomaticotemporal nerve, which you have already studied as a sensory nerve to the scalp. Now the formation of zygomatic arch I have already mentioned. Zygomatic arch has 2 surfaces, an outer subcutaneous surface and an inner surface that faces the gap that communicates temporal fossa to infratemporal fossa. The zygomatic arch also has a superior almost even border and an inferior uneven border. The superior border of the zygomatic arch attaches or gives attachment to 2 structures. One is the aponeurosis of the scalp, that is a gallia aponeurotica comes and attaches onto the upper border, and deep to that the temporal fascia which arises from the superior temporal line comes and attaches deep to gallia aponeurotica. The lower border and inner surface of the zygomatic arch gives origin to an important muscle of mastication called as the masseter. Now if you trace the zygomatic arch posteriorly, at its lower border is a tubercle. There is a tubercle at the root of the posterior end. At this tubercle, the zygomatic arch, that is, in fact this part is formed by zygomatic process of the temporal bone. The zygomatic process of the temporal bone at this tubercle will divide into 2 roots, which can be seen both from the base as well as from the superior aspect. It divides into an anterior root as well as a posterior root. The anterior root runs horizontally, medially, whereas the posterior root runs posteriorly and continues as the supramastoid crest. So if you look at the anterior root on the inferior aspect, it forms a large eminence called as the articular tubercle. This bounds the mandibular fossa anteriorly, preventing anterior dislocation of the head of the mandible. If you look at the posterior root, it terminates at a very ill-defined tubercle, which is called as this post-glenoid tubercle. And then we have the mandibular fossa. This is also derived from the squamous part of the temporal bone. This is the articular part of the mandibular fossa. Behind that is the non-articular part of the mandibular fossa, which is derived from tympanic part of the temporal bone. So you can see here the squamous part forms the articular part of the mandibular fossa. Tympanic part forms the non-articular part. They are separated by a fissure. So this fissure, how will we call it? You can call it as squamo-tympanic fissure. If you look very carefully, you can see a very thin plate of bone within the fissure. This bone is called as tegmen tympani, which is derived from the petrous part of the temporal bone. So this petrous part of the temporal bone, which grows into this fissure, will divide the squamo-tympanic fissure again into two parts. Anteriorly is the petro-squamous fissure, which does not transmit any important structure, and posteriorly we have petro-tympanic fissure. At the medial end of the petro-tympanic fissure, it transmits three structures, namely anterior ligament of malleus, anterior tympanic vessels, and cauda tympani nerve. So that completes the mandibular fossa. Now we have the tympanic part of the temporal bone. At its inferior border, it forms a sleeve that splits to enclose this process, which is called as the styloid process. Normally it will be 2.5 centimeters long. The tip is broken in this case. The base or the root of the styloid process will be enclosed by a sleeve formed by the tympanic part of temporal bone. Now traced backwards, it bounds an opening called as the external acoustic meatus. So what you are seeing here is the bony part of the external acoustic meatus, whose roof and upper part of the posterior wall is formed by the squamous part of the temporal bone, whereas anterior wall, floor and lower part of the posterior wall is formed by tympanic part of the temporal bone. This is the free lateral end of the bony part of external acoustic meatus. At this point, the cartilaginous part of external acoustic meatus will attach. In the medial free end, there is a sulcus which may not be clearly seen in a skull. This is called as the tympanic sulcus that gives attachment to the tympanic membrane. Deep inside, you may be able to appreciate two openings, which are the oval and round windows. Now we have the stylomastoid part of the Norma lateralis. This includes a process which I have already told, that is the styloid process, another conical large process called as the mastoid process, and a foramen between them called as the stylomastoid foramen. So let us see the features of each of this one by one. So styloid process is a 2.5 centimeter bony process which is attached to the temporal bone, and the root is enclosed by a sleeve derived from the tympanic part, and the process will be directed downwards, forwards. It will be 2.5 centimeters long and directed downwards and forwards. This process gives attachment to three muscles and two ligaments. The two ligaments, stylohyoid and stylomandibular ligament, are attached to the tip, whereas the three muscles, first one is styloglossus muscle, which is attached to the anterior surface and goes to the tongue. Then we have a stylopharyngeus muscle, which will be attached to the inner surface or the medial surface and goes to the pharynx. And attached to the posterior surface, midway between the base and the tip, is a stylohyoid muscle that goes towards the hyoid bone. So these two ligaments, stylohyoid and stylomandibular ligament, and the three muscles, that is styloglossus, stylopharyngeus and stylohyoid, are together called as the styloid apparatus. Styloid process may be abnormally longer in some individuals. In such case, it presents as a pain within the tonsillar fossa. This condition is called as Eagle syndrome. Now, let us see the features of the mastoid process. This is a conical process which develops only after 2 or 3 years of age due to the pull of a strong muscle of the neck called as the sternocleidomastoid. This mastoid process has a free tip to which three muscles are attached from above downwards, namely sternocleidomastoid, splenius capitis and longissimus capitis. These are the three muscles that are attached to the lateral surface of the tip. whereas to the medial surface of the tip is a deep groove called as the digastric groove, to which posterior belly of digastric is taking origin, and still medial to it is a groove that transmits the occipital artery. So what is present within the mastoid process? Within the mastoid process, we have mastoid air cells that communicate with the mastoid antrum and thereby to the middle ear cavity. So how do we identify mastoid antrum on the external skull? It is identified by this triangular area present behind and above the external acoustic meatus and above the mastoid process. It is bounded above by the supramastoid crest, in front and below by the posterior margin of the external acoustic meatus, and behind by a vertical tangent drawn to the external acoustic meatus from the supramastoid crest. This triangle can be identified in a living person at Simba conchae of the auricle. 12 to 15 mm deep to this triangle, we have the mastoid antrum in adult, whereas 2 mm deep to this triangle in a child, in a newborn, there is mastoid antrum. This triangle is called as suprameatal triangle or supramastoid triangle. It is also called as McEwen's triangle. So as I already said, the thickness of the bone here in a newborn is only 2 mm. The thickness of the bone here grows at the rate of 1 mm per year to achieve the adult thickness of 15 mm in an adult. Behind the mastoid process, we will find a foramen which is called as the mastoid emissary foramen. This mastoid emissary foramen transmits emissary veins that communicates the scalp veins to the sigmoid and transverse venous sinuses. Now, just like pterion that we saw in the floor of the temporal fossa, there is another important landmark present posteriorly where 3 bones meet. Mastoid part of temporal bone, postero-inferior angle of the parietal bone, and the squamous part of the occipital bone, meeting at 3 sutures, namely parieto-mastoid suture, occipito-mastoid suture, and lambdoid suture. This point is called as asterion, which represents the posterolateral fontanelle in a newborn, which is also called as mastoid fontanelle, which usually closes by 1 year of age. Deep to this fontanelle, we will have the sigmoid and transverse venous sinuses. Now we have completed most of the features present above the level of zygomatic arch and posteriorly, that is, it includes external acoustic meatus as well as the stylomastoid part. Now, below the level of the zygomatic arch, we have the infratemporal fossa. Infratemporal fossa is bounded anteriorly by the posterior surface of body of maxilla. Posteriorly, it is free. Inferiorly also, it is open. Medially, it is related to the pterygoid process of the sphenoid bone, specifically the lateral pterygoid plate. In the upper part, that is the roof of the infratemporal fossa, is related to infratemporal surface of greater wing of sphenoid. And laterally, we have removed the mandible here, otherwise it will be related to the inner surface of ramus of mandible. Infratemporal fossa contains the pterygoid muscles as well as maxillary artery first and second part, as well as a mandibular nerve and otic ganglion. Infratemporal fossa has been dealt with in detail in another video. Let us just see the communications of the infratemporal fossa in this video. At the junction of roof and anterior wall is a narrow fissure through which the infratemporal fossa communicates with the orbit. This fissure is called as inferior orbital fissure. In the medial wall of the infratemporal fossa is a fissure which lies between the posterior surface of body of maxilla and the pterygoid process of the sphenoid bone. This fissure is called as terico maxillary fissure, through which the infratemporal fossa communicates medially with the pterygopalatine fossa. In the roof of the infratemporal fossa, in the greater wing of sphenoid, we can see 2 foramina. There is a large oval foramen called as foramen ovale and a small foramen close to the spine of sphenoid called as foramen spinosum. Through these 2 foramina, infratemporal fossa communicates with the middle cranial fossa above. The structures passing through foramen ovale are mandibular nerve, accessory meningeal vessels, lesser petrosal nerve and an emissary vein. There are two structures passing through foramen spinosum. It includes nervus spinosus or the meningeal branch of the mandibular nerve and middle meningeal vessels. Having completed Norma lateralis, let us revise some salient features that we saw in today's video. So, this is the frontozygomatic suture. This is the zygomatic process of the frontal bone. Arching above and behind, we have two temporal lines, the superior and inferior temporal lines. If we trace the inferior temporal line downwards, it continues as a crest, which is called as supramastoid crest, which then continues with the posterior root of the zygomatic arch. The zygomatic arch is formed by temporal process of zygomatic bone and zygomatic process of temporal bone. Above this depression is called as the temporal fossa, and this cavity below, this is called as the infratemporal fossa, and the two fossae communicate through this gap between the zygomatic arch and the lateral aspect of the skull. In the floor of the temporal fossa, this is a very important surface landmark. This structure, this point is called as terion, which is identified 4 centimeters above the zygomatic arch and 3.5 centimeters behind the frontozygomatic suture. Then the most important feature that you can see in Norma lateralis is the external acoustic meatus. Behind and above the external acoustic meatus, we have the McEwen's triangle, which forms the lateral wall of the mastoid antrum. Then we have the styloid process, which gives attachment to 3 muscles innervated by 3 different nerves and 2 ligaments, together called the styloid apparatus. Then there is a large conical process called as a mastoid process, which gives attachment to 3 muscles on the lateral aspect from above downwards, namely sternocleidomastoid, splenius capitis and longissimus capitis. On the inside surface, we have the mastoid notch to which the posterior belly of digastric is attached. Between the styloid process and the mastoid process is a foramen called as a stylomastoid foramen, which transmits facial nerve and stylomastoid vessels. Behind the mastoid process, we have a mastoid emissary foramen, and above that is a point which is called as asterion, where 3 bones meet. Terion represents the anterolateral fontanel, which closes by 3 months of age, whereas asterion represents the posterolateral fontanel, which closes by 1 year of age. With this, we complete the discussion on Norma lateralis. Let us see in another video. Thank you.